general conclusion is for me, I got a responsibility from our chairman. It's very easy for me to conclude that because I am very happy, because today what I have heard is exactly what I was wishing to hear since more than 30 years, I've been convinced since many years that I would say blockbusters will not satisfy the future needs, So during many years, I have seen all those populations. I have been a scientist, an investor, a pharma person, a biotech person. I've seen those populations not speaking too much, and even competing, because, the patient association were thinking that the other were trying to make money on their back, The pharma company were not interested because they were only looking for billions US dollar drugs, and the investors were convinced that it was not possible to make money in orphan diseases or targeted therapies, So, and you had not so many biotech companies or small or medium-sized companies wishing to address, the problem. So today it has changed a lot. I've seen during the last years, patient association, we have seen a good example, understanding that it was impossible by themselves to develop drugs because the lack of expertise in drug development, the lack of funding. We saw that with Biopontis, The pharma companies have understood that the world was changing and they were needing to develop more specific drugs to address a specific population. And the investor, finally, they have understood that it was possible to make money, but also to improve their image, and also to, I would say, to give the image of organization wishing to improve the quality of life, which is very important for their clients. So it is changing. Also, many small companies or biotech companies wishing to address the sector. We have seen hundreds of companies targeting orphan diseases or targeted treatments. So it is really changing. And this, as we have seen, has been authorized by the fact that artificial intelligence and e-health was developing. So it is absolutely essential and becoming, even if it is too long, but it is now happening. It has happened in Israel, I know well, but also in Europe, in US. But Europe has a good target, has a good challenge to take, because Europe has, I think, is strong in the field at the research level, application level. A friend of me last week had two sentences. He said to me, in the future, all drugs will be developed using explainable artificial intelligence. Explainable artificial intelligence is important. Second sentence was drug development is a learning problem, not a testing problem. I think you have to think about it, because I think it's really smart, and this guy is leading a company. I think he will be successful. He's thinking that. So we have organized this event. We'll have another event because we want to continue to develop the ideas which have been developed. Next event organized by the fund, by our fund, will be in October, on October 4th and 5th. We have a roundtable to report what has been said today. This roundtable will be shared by my friend Eric. We'll have in this event in Paris, in the Peninsula Hotel, a very nice place to be. We'll have more than 300 investors coming from around the world, from US, from Asia, from Europe, from Israel, We'll have 20 large pharma, and we'll have 200 biotech companies interested by those sectors. And the challenge we have is to transfer what has been said today, with it changing, and to convince investors to invest more money, because to develop a drug, I am in this field since 45 years, you need money. You need expertise, but you need money, so you cannot escape this situation. So we have investors very interested, we selected them, very interested by those diseases, rare diseases, targeted therapies. We'll have 20 pharma looking at it, and we'll have many biotech looking for projects and to take projects from science. So I hope it will be successful. I know it will be successful, and I wish that all of you attending this event will be also present during that second event in October, when I think concrete decision will be taken to collaborate and to fund. Thank you for your attendance. Thank you very much. Alison, you want to conclude?
I will conclude. Thank you so much, because that has been so stimulating. And our afternoon has all too quickly come to an end. We hope you have enjoyed it as much as we have. And we have many people we wish to thank before we go. We wish to thank Marie-Yvonne Hyans and Christian Policard and Eric also for their initiative together with their conviction, their energy, their motivation, and their organization. Please, it's coming. It's coming for this very important creation of a very new event, HealthTech for Patients. We also wish to say a special thank you to Joanna Maria Gligor and Ander from the European Commission in their recognition of the importance of patients at the heart of innovation in health. Of course, we wish to say a huge thank you to all our panel of distinguished guest speakers who have shared their expertise, opened our eyes, and elevated our thinking today. Many thanks equally to our talented moderators, to Anka, Petre, Christian, and Eric, for the tables and discussions we've had today. We would also like to say a very big thank you to all our friends here at the Hub Institute for making this edition take place seamlessly and so well. And of course, tons of thanks go to the organizing team, Nathalie Don, Estelle Metzger, Solène Goupy, Kadia Touba, and Nael Damu, who have worked tirelessly behind the scenes to make this event happen. And of course, we wish to thank you, the participants who have joined us today to start our conversation. Right after this event, you will be receiving a replay of the afternoon and a survey of satisfaction. And we look forward to welcoming you again to continue our discoveries and our discussions at our future events for Health Tech for Patients. Until then, stay safe, take care, and goodbye.
Thank you.